Hi, I'm Dr. Doug Thal, an equine vet and the creator of Horseside Vet Guide. In this video, I want to illustrate something to you that could save your horse's life. As a caretaker for your horse, it's vital you know something about wounds. This mare was being galloped across a pasture with some other riders just a few hours before this photo was taken. The owner thought initially this wound might be minor. It was a small wound and the horse didn't seem very sore. The owner knew how to treat wounds, so he thought he might treat this one. But within a few hours, the mare was very lame and there was increasing swelling. He decided not to take a chance, and so he brought her into our equine hospital. Here you can see all the swelling around the fetlock. The fluid you see here is actually joint fluid dripping out of the wound. So what makes this a life-threatening wound? Whenever a horse has a wound near a joint, especially any wound low on the limb, and especially when the horse is lame, you want to assume that it's very serious until it's proven otherwise. We always think about anatomy when we're considering whether a wound is serious. In this case, you can see, if you look at the anatomy, that this is close to the fetlock joint, a vital high motion joint that's not tolerant of injury. So in this case, we initially cleaned the wound up, probed it carefully, we took some x-rays, and did some other diagnostic tests. We determined that the wound had entered and infected the fetlock joint. Within the hour, we had the mare on the surgery table. So here she is anesthetized on the surgery table. You can't see the wound here as it's in front of the joint and hidden. But I took a needle and I put it in the joint, and you can see pure pus coming out of the needle. After this, I put other needles in the joint, and we did an aggressive flush of the joint using large volumes of sterile fluids under pressure to get all the infection and toxic products out of the joint. There's a large tube in the wound in front, and there's 4 needles here in different parts of the fetlock joint. We did this so that we didn't leave any infected material in one of the hidden corners of the joint. We also used regional limb perfusion, and we put antibiotics directly in the joint when we were done. We kept this mare in the clinic for a week, doing sterile bandage changes and regional limb perfusions as the wound healed. She did great, but the only reason she did was because her owner recognized this was not a wound to try to manage himself. Had he tried to treat it for a day or two, the cost of treatment would have doubled, and so would the likelihood that she would be permanently lame or even have to be euthanized. For lots more high-quality information just like this, created by an equine vet, visit our website, horsesidevetguide.com.